what is bipolar disorder?
So bipolar disorder is traditionally classified as a mood disorder. And as a mood disorder, people will have both symptoms of depression and what's called mania or hypomania, which is kind of a milder version of mania. Basically, people will, those are the two poles, as we talked about earlier. People may have periods where they have, you know, feelings of sadness, sleep disturbances, inability to feel pleasure, feelings of hopelessness, poor energy, poor concentration, appetite, thoughts of suicide. Depressive episodes is what those are that may last for weeks or months if untreated, maybe even years in some patients. And then the other side of the coin is these manias or hypomanias. So people may have periods of times, and it's always important to determine during periods of sobriety if this occurs.
Absolutely.
That people have episodes of decreased need for sleep for days at a time. And by that I mean, has there been ever a time where you were able to stay awake and not have to sleep for days at a time, more than 3 days at a time, more than 5 days at a time, as long as an entire week at a time, and not feel tired? So, and I think that's kind of the ultimate, you know, confounder. You know, a lot of people will have insomnia, sleep disturbances. A lot of people will have periods where they want to sleep, but for these episodic decreased need for sleep, there is no desire to sleep. And during these periods of time when you're not sleeping, there is unusual irritability. There's unusual euphoria. By that, I mean you feel you're on top of the world. There is unusual productivity. For example, I painted the entire inside of the house in a weekend. There is unusual risk-taking behavior, spending large sums of money for people that typically would not spend, you know, having sex with many people, assuming that's not, you know, kind of your typical behavior, aggressive speeding. And oftentimes during periods of manias, people may find themselves in circumstances that get them into a lot of trouble.